For our goodwill message, I will invite from Department of Planning, Research and Statistics for a very quick goodwill message from Federal Ministry of Health. Let me invite Dr. Ijaoduole Olubenga.
Please. Thank you very much. The representative from the Regional Minister of State for Health, the Mandate Secretary, distinguished ladies and gentlemen, please permit me to stand on the existing and established protocol. On behalf of the Federal Ministry of Health and all its related and relevant departments, it's a great honor to deliver this goodwill message at this particular important event. Today we gather for the Nigeria Telehealth Conference, a milestone event highlighting our commitment to the use of digital health innovation to improve healthcare in Nigeria. We are all familiar with what we plan to do as part of our goal and objective for this current administration to reduce physical and financial pain, to improve healthcare system, and to save lives. The theme of this event, Scaling Health Telehealth for Universal Health Coverage in Nigeria, Pathway to Sustainability, underscore our nation's journey to equitable, accessible, and affordable healthcare for all. We are expected not to leave anyone behind. Technology is a powerful catalyst for transforming health system, and telemedicine is a present reality that can bridge human resource gap and connect underserved community to qualify medical experts. We just get the testimony from FCT, and we believe that we are on the right track to do that. The Federal Ministry of Health and Social Welfare has made remarkable progress in pioneering pilots, digital health innovations to improve healthcare in Nigeria, and we believe that telemedicine is transforming our healthcare system by increasing access to medical care through the use of various tools that are applicable in country. This approach, we believe, will benefit rural community in several ways. Will help us to overcome our limited facility, the long distance, reduce hospital congestion, and enable better follow-up care for patients, especially with chronic conditions, and also improve on health education and awareness while we are trying to save costs. We are also familiar with the challenges that we'll be facing, what we have been facing over the years in terms of improving digital health in Nigeria. We know about the issues with infrastructure, the connectivity issues, the literacy, and the patient acceptance concern. And also we talk about regulatory and policy barriers, the issue about the security and the privacy concern. All these are what we are working on to unlock its full potential by developing clear guidelines and regulation to ensure that what we are producing, what we are giving to Nigerians are of quality, have the necessary security, and also promote privacy. The government, through the ministry and the private sector and all other key stakeholders, are working together to ensure that we integrate telemedicine into our national healthcare system and drive innovation in our digital healthcare services. We believe that this conference provides a platform for us to provide the necessary input into the national teleconference telehealth guideline, and we believe that this will help us to be able to improve on our policy footprint for integrating telemedicine into our healthcare system, focusing on the standard, the regulation, financing, and digital infrastructure, and the workforce readiness. I would like to appreciate Movie Health for convening this important event, and we believe in collaboration with all our key stakeholders across the country, we believe that we're on the right path to improve healthcare system in Nigeria. Thank you very much.
We'll now go straight to our keynote address. The keynote address for the Nigerian Telehealth Conference 2025 will be given by the Honorable Minister of State Health, Honorable Dr. Isiaq Salako, who is here perfectly represented by the Senior Technical Advisor on Digital Health to the Honorable Minister. I'd like to specially welcome Dr. Oluniki Ujirani. Please, can we put our hands together for
The Mandate Secretary, Federal Capital Territory, distinguished directors, esteemed development partners and donor agencies, representatives of the National Health Insurance, NHIA, representatives of NPHCDA, other MDAs here present, leaders of professional and private health associations, members of the press, distinguished guests, ladies and gentlemen. It is my great honor to deliver this address on behalf of the Honorable Minister of State for Health and Social Welfare, Dr. Isiaq Adekunle Salako. At this important event, we gather today for the Nigerian Telehealth Conference 2025, a milestone event highlighting our commitment to digital health innovation and sustainable healthcare delivery for all Nigerians. The theme of the conference, Scaling Telehealth for Universal Health Coverage in Nigeria, Pathway to Sustainability, underscores the nation's journey towards equitable, accessible, and affordable healthcare. Technology is a powerful catalyst, as we all know, for transforming health systems. And telemedicine is not just a vision for the future. It is a present-day reality, like the Mandate Secretary alluded to, that sort of bridges the gap with the human resource gaps and connects underserved communities to qualified medical experts. Under the Renewed Hope agenda of the President Bola Ahmed Tinubu, GCFR, the Bespoke Nigeria Health Sector Renewal Investment Initiative aims to transform our country's healthcare system. The implementation and eventual success of this initiative hinges on the Nigeria Digital Health Initiative as a core pillar of implementation, championing a unified and secure health data architecture that supports this vision. This year's Telehealth Conference marks a significant milestone in our collective journey towards a digitally enabled health system. It provides a national platform to showcase, test, and as well validate innovative telehealth and digital health solutions across key areas, including e-prescription, immunization tracking, maternal and child health referrals, and claims management systems. Through these efforts, interoperability becomes more than a technical goal. It ensures that no data point, no patient, no community is left behind, and the seamless exchange of health information that strengthens our healthcare delivery system, decision-making, and resilience. We acknowledge that challenges persist, ranging from fragmented healthcare data systems, infrastructure, connectivity limitations, to issues of digital literacy, patient acceptance, regulatory frameworks, and data privacy. The Ministry of Health, in collaboration with the private sector and development partners, is working tirelessly to establish clear guidelines and robust governance mechanisms to ensure quality, security, and trust in telemedicine and digital health services. As we proceed on this remarkable and landmark journey, this conference aims to provide a platform to validate and align the National Telehealth Sustainability Framework, which will be presented at the forthcoming National Council on Health meeting later on this November. The framework serves as a policy blueprint for integrating telemedicine into our healthcare system, addressing standards, regulations, financing, digital infrastructure, and workforce readiness to ensure sustainability. I wish to express the Federal Ministry of Health's deep appreciation to our development and technical partners, the conference co-host, Mobi Health, and collaborators for their steadfast support. I also commend the private sector, because without the private sector, we really cannot move far, innovators, and the planning committee for these tireless efforts. Together, through the Renewed Hope agenda and collective national commitment, we can enhance technology to build a resilient health system one where no Nigeria is left behind in assessing quality healthcare. So I wish us a fruitful deliberation. God bless you. God bless the Federal Republic of Nigeria.
Hello everyone, it's a pleasure to join you all at this very important event focusing on scaling telehealth for universal health coverage. Over the next 2 days, participants, panelists, and a number of people will come together to address key issues that have implications not just for this event, but more importantly, for how we move forward with health service delivery in Nigeria. I particularly look forward to the expected outcomes, some of which will culminate in a resolution that will go to the National Council on Health later this month. So on behalf of myself, my colleagues at the Sub-National Commissioners of Health, we welcome you all and we look forward to a much fruitful meeting.
Good morning all and welcome to this delightful conference. I see a lot of faces, some my friends, some my teachers, some my colleagues. I have to leak on Dr. Arobindade. We did house job together. And I'm not surprised he's here because right from then, we didn't have phones, we didn't have those things, but he had a way of taking like 3 calls. When I want to go home, I'll give him my call and he'll take it. So I don't know how he did it, but kudos to you. You're here again. Now, telemedicine is not new. If we think about what happened during Corona, we conquered that war with telemedicine. Contact tracing, treatment, etc. And in doing some literature review, I got to find out that actually in 2006, this country, Nigeria, Federal Ministry of Health, partnered with National Space, something, you can find it, to launch the first digital telehealth system. I wonder what happened to it. The truth is, I will not tell you that that is all we need, because we need empathy, we need a human touch, we need to see the people we're talking to. But in the absence of that, for example, right now, resident doctors are on strike. I'm happy to say I have a partnership with Mobi Health, and I have the first ever booth in Duse Makaranta Primary Healthcare Center. And because of the strike, there's a long queue. And I start to think that this is sustainable. Why would someone go to Asokoro because the nurse on duty suspects pneumonia just because she's coughing? And say go and take an x-ray, she would have to, the cost of travel, cost of time. Or if you're talking to a specialist on the other line, he knows what to ask you. There's a book called Where There Is No Doctor. We all studied community health. We had community health postings. And I believe that the thing with Nigeria is, I'm a government worker. The renewed Hope administration is trying to switch from a linear economy to a circular economy. And in a circular economy, there are no gaps. There's a complete circle. But with telemedicine, we have gaps right now. Who regulates who? If a doctor tells you, take glucophage, 2 tablets, once a day, and you mix up your glucophage with paracetamol, and then you go into a hypoglycemic coma, who do we hold responsible? Do we start to check your phone and say, oh, somebody told her to do this and that? So we need regulations, we need policy, and we need accountability. And I'm happy to say, in the FCT, we have all of that sorted out. I close by saying the strike is biting hard, but the consultants are in the hospital. From Dutse Makaranta, you can talk to a cardiologist, you can talk to a neurologist, you can talk to a pediatrician without spending a dime. I'm also happy to say that our health insurance scheme has considered all pregnant women vulnerable. And in considering them vulnerable, they have free health insurance. They deliver for free on the condition that they attend antenatal health care. And the last joint meeting we had, FCT's skilled birth delivery percentage was 25%. Facts again from the Federal Ministry of Health, we're at 102% right now. And this is because when we say it, we do it. When you come to our centers, you get what we say you will get. I close by thanking my health insurance director, Dr. Belgore. She's right there. Stand up, Dr. Belgore. And for the first time in the history of this country, I have another state paying me for their pregnant women. Because people come from, what's that state, Nasarawa, to access healthcare here. So we had to have, we had a meeting and had a handshake with the Commissioner for Health and the DG Health Insurance Scheme. And this brilliant lady came up with, why not? We're trying to reduce maternal mortality, not only in Abuja. If we reduce it in Abuja, by the time we go on the national scale, it's probably 0.000 something. It doesn't work. So you're welcome from Nasarawa as long as your HMO pays. And we're the only health insurance system that is prepaid, not postpaid as of now. Please fact check that. Thank you very much.
Good morning, ladies and gentlemen. Good morning, everyone. I am glad to be here and to be a part of this discussion. I'm Dr. Abisola Adeboke, MNM, Director in charge of Teaching Hospitals Division in the Department of Hospital Services, Federal Ministry of Health. And I'm here this morning to stand in for Dr. Salahuddin Olawale Jimo, who is on another official assignment and is unable to be here this morning. The discussion we're having today, honestly speaking, is a good one because we are on course. As far as medicine is concerned, it's been said now that the world is a global village. And apart from that, we do not even have enough doctors, to cater for the masses that, need medical help in one way or the other. So I want all of us to pay close attention because there's a lot to learn, to unlearn, and to relearn this morning. I want to congratulate the convener, Dr. Fumi Adewara, for this laudable initiative. I want to appreciate each and every one of us that are seated here this morning. You are all important, and highly distinguished guests. I also want to thank the press, the media. For me, it's a good one for us to be a part of today. And this presentation that is coming our way, well, if you want to tag it, it's an overview. Because as far as the Department of Hospital Services is concerned, we also have a division in the department, that is e-health. And e-health has been working closely with mobile health and all other relevant stakeholders. Someone also is here, in person of Dr. Benga Ijaudola, who is also here standing in for Director of Health Planning, Research and Statistics. Let me tell us that the discussion we're having today, the ministry is very much interested in it. Remember that the guidelines, also is domiciled in the ministry. And so I want all of us to, be a part of this discussion. And I'm going to be giving us an overview, a background, we'll talk about, the people that I've been collaborating with. I will also make mention of some of the challenges and proffer, recommendations. And even with that too, it will also broaden our mind so that, in Kuru, where you identify problems and you talk about the challenges, it's expected that you talk about recommendations. And you don't just stop there, you also must include implementation strategies. So, whichever way you have to come in whatever capacity, please, we all have something to offer. So thank you very much. And so I want to quickly, tell us about the current status of telemedicine services in Nigeria. And so permit me to stand on already established, protocol. Let me align myself with it. And I'm here to tell us that telemedicine is no longer a futuristic idea in Nigeria. That is the truth. It is a growing reality that is gradually redefining how we deliver healthcare, bridge distance, and ensure equity in access. Nigeria seeks to achieve a digitally enabled health system that is efficient, equitable, and people-centered. And as part of the ministry's digital transformation agenda, telemedicine is being mainstreamed into national health programs under the Department of Hospital Services. And just as I've also mentioned, it is being coordinated by the e-health division. And the ministry is working closely with relevant ministries, departments, and agencies, such as National Information Technology Development Agency, NITDA, National Health Insurance Authority. Remember, you really cannot go far unless there is money. Out of pocket is very expensive, and so there is need for NHIS, now NHIA, to come on board. And so the ministry also is partnering with NHIA, National Space Research and Development Agency, NASDA, National Data Protection Commission. Same also with Medical and Dental Council. We have partners such as World Health Organization, civil society organizations. We have them like Telemedicine, Society for Telemedicine, and e-health in Nigeria. And so together with these partners and MDAs, we are developing national telemedicine guidelines to ensure seamless practice. And as of 2025, I can make bold to say, and many of us, we know this, that telemedicine services in Nigeria, they are functional, though at varying scales in both public and private healthcare facilities, both in the federal and the subnational levels. We are aware that some clinicians are conducting video consultations with specialists hundreds of kilometers away, and this is a powerful reminder that digital access can be achieved when infrastructure, regulation, and political will, when they align. I want us to clap for the federal government, please. We are looking so serious. Please clap, 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 and clap for yourself too, for being a part, of this story today. And so to sustain these gains, the Federal Ministry of Health, through the e-health division, is advancing in developing a national telemedicine guideline alongside relevant stakeholders that have earlier on mentioned. The ministry also is working on digitization of hospitals, electronic medical record harmonization, and interoperability frameworks to ensure teleconsultations integrate seamlessly with National Health Information System. And I also can testify that in the Department of Hospital Services, because all the federal tertiary health institutions, they're about 84 in number, teaching hospitals, federal medical centers, and specialty hospitals. From time to time, we do engage them by asking them, how far have you gone? What is the percentage? What challenges are you having? How can it get better? And I'm sure some of them, they are already, they are almost there, because I do not want to say that they are there, because there's always room for improvement. And then there's also something that I'm also sure of. As far as interoperability is concerned, the Department of Hospital Services is also doing a lot regarding that. Because you may have a patient who has been receiving treatment in Lagos, and then for whatever reason, the person is in another part of the country. So the person, should be, the clinician should be able to have a conversation, or at least have the relevant, records about how the patient is being managed. It will only enhance, the healthcare service that the patient is to be, is to have. But are we there? I said no. And so there are challenges. And if there are challenges, then there certainly must be, solutions or recommendations. And so what are the key challenges? I'm glad that some have already been mentioned. And that is why I said that more or less this is an overview. Some have been mentioned, but we can never have enough of it. It simply reinforces the idea that yes, there are challenges. And when there are challenges, there must be solutions. And so what are the key challenges? One of such is limited broadband coverage. We all know how unreliable our data connectivity can be. And we know that there's no way telemedicine can be properly put in place when we have unstable internet for video consultation, data sharing, and access to online records. When there is poor connectivity, it limits the reach and effectiveness of consultation. What is another major challenge? It's having to do with inconsistent power supply. We all know, I'm glad when Dr. Belgori was speaking, and she made mention of, solar-powered, devices. And so, as far as the country is concerned today, the government is trying, but you and I know that power is still a challenge in the country. And so when there are frequent power outages in healthcare facilities, it makes it really difficult to use digital devices, to maintain servers, or to conduct virtual consultations consistently. Another challenge is that of fragmented solutions. We have different hospitals, both at the federal and state, that are using uncoordinated telemedicine platform. And so when it comes to, having communication seamlessly, it is difficult. And so this creates data silos and makes it difficult to track patients across systems or scale innovations nationally. What about payment of services? We know that as it stands today in the country, a lot, when it comes to payment, it is largely out of pocket. And so there is currently no consistent model for paying telemedicine providers or reimbursing patients. Many teleconsultations are done out of pocket, which limits access, especially for low-income populations. There is yet another one, and that is variable provider readiness. We have a number of our staff that are not trained, they are not digitally literate, and so they are not well equipped to deliver telemedicine effectively. And so it is not just enough to have the gadgets in place, but people also must be trained for them to be able to deliver, appropriately. During the panel discussion, someone made mention of regulation. That also is a problem, So as I begin to round up, I said that there are challenges and definitely there must be solutions. And so, what are the things that we need to put in place for us to have, to get to where we are going? One is to expand broadband infrastructure through collaboration with the Ministry of Communication, Digital Economy, and NITSDA. We also have to encourage private telecom companies to invest in rural internet expansion through incentives such as tax relief or PPP. We have to deploy alternative energy solutions like solar power or hybrid systems in health facilities. We also have to integrate telemedicine equipment into battery backup systems. We have to develop a national telemedicine guideline and interoperability frameworks that ensure systems that can share data securely. We also have to promote standardized software and data exchange protocols. We have to collaborate with NHIA to include telemedicine in insurance benefit packages. We have to establish clear reimbursement models and billing codes for virtual consultation. Remember, I made mention of inadequate training, and so capacity building on digital literacy program among health workers is a must. We also have to integrate telemedicine training modules into medical and nursing curricula, as well as provide technical support and incentive for early adopters of telemedicine. And so when we are ready to embrace all of this, we will surely make visible progress. And so in conclusion, Nigeria's telemedicine ecosystem is advancing steadily and is expected to move from isolated pilots to coordinated national action. Our goal as Federal Ministry of Health is to make quality healthcare accessible to the 250 million Nigerians, regardless of distance. I believe that with continued collaboration among government, clinicians, innovators, and partners here today, that goal can certainly be reached. Thank you very much for listening. Thank you.
So for the purpose of protocol, we have lots of people that are playing different roles in this event, but because we have to move against time, I'll be profiling people as it's their time to give their speeches or land on panel. So just permit me to quickly run to the opening remark as I especially salute and recognize the Honorable Minister of Health, who is ably and perfectly represented, and also all government leaders that we have here. I'd like to also recognize all health professionals. This is a gathering of so many medical doctors and pharmacists that we have in our midst. All our development partners that are here will also specially recognize you. The private sector individuals and key players will also specially appreciate you for coming. A civil society and everyone that's seated here to help drive this cause. Let me also salute and welcome gentlemen of the press and of course distinguished ladies and gentlemen. We'll begin very formally, and of course it's proper that we get a very warm welcome. And to do that for us is a lady, I'm not sure she has slept for maybe about the last 17 nights to make sure this event will come to a wonderful reality. I'm sure your warm welcome to her on stage will do a lot in getting her gingered, as she will also be awake the next 2 days to appreciate God for a healthy conference. I'd like to welcome the founder and chief executive of Mobile Health International. Please help me welcome Dr. Fumi Adewara.
Distinguished ladies and gentlemen, and all esteemed partners, colleagues, members of the media, ladies and gentlemen, good morning. It gives me great pleasure to welcome you all to the Nigerian Telehealth Conference, convened under the theme Scaling Telehealth for Universal Health Coverage in Nigeria, Pathway to Sustainability. My name is Dr. Fumi Adewara. I am the founder and the CEO of Mobile Health International. It is both an honor and a privilege to stand before you today as a convener of this landmark event. Permit me to begin by expressing my deepest appreciation to our special guest of honor, the Honorable Minister of State for Health, whose presence underscores the government's unwavering commitment to advancing accessible, affordable, equitable healthcare for all Nigerians. We also wish to acknowledge the presence of Dr. Mohammed, I don't know if he's in the audience yet, but maybe on his way, Yakasai, the Special Technical Advisor Programs, Office of the Special Advisor to the President on Health, who is representing Dr. Salma Ibrahim, the Special Advisor to the President on Health. We deeply appreciate her visionary leadership and the Presidency's strong commitment to strengthening Nigeria's health systems through innovation and digital transformation. We equally recognize the leadership of the Federal Ministry of Health and Social Welfare and our esteemed partners from the NHIA, the National Primary Healthcare Development Agency, World Health Organization, our headline sponsor, Afrexim Bank, who has graciously provided this venue and all the refreshments you're going to have today, NIGDA, as well as all our distinguished colleagues from the private sector, healthcare associations, academia, and the Nigerian diaspora. I want to especially also recognize the FCT Mandate Secretary, Dr. Adedolapo Fashawe. She's also on our way here. Without her, we wouldn't be here today. So she's our chief host under the leadership, of course, of the FCT Minister. To our media partners, supporting organizations, and dedicated volunteers, thank you for amplifying this vision and making today possible. Why are we here? We gather here today because we share a common conviction that quality healthcare is a right, not a privilege. Across Nigeria and Africa, too many communities remain beyond the reach of essential care. Yet, innovation gives us a new opportunity to rewrite that story. At Mobile Health International, we have seen firsthand how technology, through telemedicine and digital health, can bridge long-standing gaps in access. Our solar-powered, satellite-connected telehealth clinics are already transforming healthcare delivery in underserved communities. But today is about more than one initiative. It's about a shared national mission to institutionalize telemedicine as a key pillar of universal health coverage. Our shared vision. Together with the leadership of the Federal Ministry of Health, we envision a future where every Nigerian, regardless of geography or income, can consult a qualified doctor and specialist 24/7. Primary health centers are connected and strengthened through digital platforms. Preventative care, health education, and follow-up care are integrated seamlessly. And our health workforce is empowered with digital tools to deliver care efficiently and with dignity. This vision aligns squarely with the renewed hope agenda of the federal government, a health system strengthened by innovation, data, and collaboration. The role of partnership and the reason why you're all invited to this event. We cannot achieve this vision alone, and we cannot achieve it in silos. It will take deliberate partnership between the government and the private sector, development agencies and academia, diaspora professionals and local innovators all working in sync towards universal health coverage. Together, we must ensure that telemedicine is not just a pilot or a project, but a sustainable, nationally adopted solution that transforms the way we deliver care. So today is a call to action to everyone in this room. As we begin today's session, I urge every participant to think boldly and act decisively. How can we accelerate and integrate telemedicine into every primary healthcare facility? How do we leverage data of disease surveillance and health planning? How do we equally ensure inclusivity, that no Nigerian is left behind in this digital health revolution? Let this conference be remembered, not for speeches, but for resolutions and actions that lead to finalization and implementation of the National Telemedicine Guideline. Once again, I thank you all. I thank the Honorable Minister for this visionary leadership, our partners for their steadfast support, and every participant here today for being part of this defining moment in Nigeria's healthcare journey. May we leave this conference more united in purpose, more determined in action, and more inspired to deliver a healthier, more connected Nigeria. With that, it is my honor and privilege to formally declare the Nigerian Telehealth Conference 2020.
Good morning. I'm delighted to be here with you virtually to give a goodwill message in this very important summit and workshop on telehealth in Nigeria. Telemedicine is a very, very important part of the healthcare value chain. Here in PVAC, the Presidential Initiative for Unlocking the Healthcare Value Chain, we look at very important value chains and try to see what can we do to unleash the potential in that area. Now, when you look at Nigeria with 230 million people, when you talk about issues around healthcare access, universal health coverage, you know that telemedicine is actually not something that is really, is something that is really desirable, that will bring about the necessary change. You look at the 4 pillars that we're implementing in the healthcare renewal investment strategy in Nigeria, and you see telemedicine implicitly embedded in each of these pillars. But more importantly, also when you look across the cross-cutting pillars, technology, innovation, access to finance, easy access, and all of those things, you see that telemedicine is a critical part of the value chain. Now, this is why this stakeholder engagement, this meeting that you're having today is really important. And I really congratulate all of you for coming together, not only to talk about policies, regulations, but also to begin to define, the standards, the regulatory aspects of all of this, so that this can be something that Nigeria can ride on to bring about healthcare access for all. I first met Mobi Health's CEO and founder, Dr. Fumi Adewara, when I was working at the African Development Bank. I saw the passion, the commitment, the desire and the patriotism that she has in this space. And I see more of this kind of passion and engagement from all similar players that many of you are in this room. And so I urge you to use this as a platform at the beginning of a dialogue. And I want to say finally that PVAC, the Presidential Initiative, we are really ready to work with you, all of you in this room, the government agencies here present, the private sector participants, the technology owners. We will work with you to make sure that we shape this space so that, again, this will be one more value chain that we are unlocking for the benefit of all Nigerians. Thank you.
The Honorable Minister of State for Health, all dignitaries here present, please permit me to stand on existing protocol. On WHO's position on implementation of telemedicine in Nigeria, for us at the World Health Organization, we have a supportive stance towards the implementation of telemedicine in Nigeria, and this is evident from the support that we have provided so far in this area, and also in consideration of the provision of guides and tools globally and in the region to support the implementation of telemedicine everywhere, and then specifically in Nigeria. For this, we always advise to move for the framework for implementation. And this framework for implementation entails strong governance. For Nigeria, we recognize the strong political will we have at this time by the establishment of the or inauguration of the Nigerian Digital Health Initiative that was launched last year. And with that, WHO believes that Nigeria is very fertile for the implementation of telemedicine and other telehealth services, and also digital health in general. WHO also supports the need for careful planning in the implementation of telemedicine services in Nigeria. Careful planning in consideration of health services, what is available, what is the supply like, what is the demand like, where the gaps are, and which services can we actually provide virtually, considering the pros and the cons of delivering services from a distance. WHO anchors this on the belief that telemedicine is one sure way of moving towards universal health coverage, because we recognize that with the current state of things across the world, and particularly in our line, it is almost impossible to reach all those that can be reached. So we align this on the universal health coverage, which means that no one should be left behind, meaning that accessibility, quality, sustainability of services should be prioritized, noting those that are vulnerable or those that are limited in one way or the other. And we advocate for the use of global standards. And for that, we have developed a lot of that on telemedicine standards for effective and equitable services through telemedicine. We also advocate and encourage alignment with the National Digital Health Strategy, which also prioritizes telemedicine as one of the ways to help the country move towards universal health coverage. We also encourage and advise for capacity building, because where you have health workers or even beneficiaries that do not understand how to use the devices available, if it is available, and also how to take these services through technology, that may be a limitation and even a bit retrogressive. We advise for the alignment to the laws of the country, such as the data protection and privacy laws, to ensure patient safety and confidentiality, and also in aligning to standards, extant standards and guidelines, because one of the key issues or key challenges is the liability exposure of providers in terms of medical error in providing telemedicine. We also advocate for integration with national systems, meaning that telemedicine should not be a standalone, but an effort made to make sure it's integrated with the national system to ensure the continuity of care, to improve outcomes and overall efficiency of the healthcare delivery system. We also advocate for evidence-based decision-making, where we promote the use of data and evidence to inform telemedicine policy and decision-making, ensuring that these services are grounded in the best available research and evaluation. For this, this is what WHO stands for, and WHO is confident that Nigeria is very ripe and even actually overripe and really needs telemedicine services and other telehealth services to advance towards universal health coverage. Thank you very much for listening, ladies and gentlemen.